Blackheads that keep coming back? Whiteheads that pop up overnight? Stop scrubbing your barrier off. Today I'll show you the ultimate safe removal routine that melts congestion, clears pores, and prevents the comeback. All with gentle, proven steps. 5 minutes gentle steam, or warm towel compress. Goal: soften oxidized sebum, blackheads, plus loosen trapped keratin, whiteheads. Add 1 drop tea tree or a green tea infusion to the bowl for a calming antibacterial boost. Tip: keep it warm, not hot, no flushing. The foundation of clear pores is a truly effective double cleanse. This isn't just for makeup wearers, it's for anyone dealing with excess oil, blackheads and whiteheads. We start with Step A, the oil cleanse. Begin with completely dry hands and a dry face. This is critical because oil and water repel each other. Applying the cleanser to dry skin allows it to directly bind with and dissolve oil-based impurities like sebum, sunscreen, and pollutants. Gently massage the oil for a full 60 seconds, focusing on congested areas like your nose and chin, last to avoid spreading bacteria. Then, add a little water to your hands and continue massaging. You'll see the oil transform into a milky emulsion. This step is vital. It ensures the cleanser and all the dissolved grime rinse away cleanly, leaving no greasy film behind. Now for Step B, the water-based cleanse. This second step removes any lingering residue and water-based impurities like sweat and dirt. More importantly, it's our chance to treat the pores. Choose a gentle, low pH cleanser with targeted ingredients. For oily or congested skin, a gel with 0.5% to 2% salicylic acid is perfect. It's an oil-soluble BHA that exfoliates inside the pore lining. If your skin is sensitive or irritated, opt for a cleanser with soothing botanicals like heartleaf, Centella asiatica, or green tea. These calm inflammation while still providing a thorough cleanse. Here's why this two-step method is the key. The oil cleanser acts like a magnet for the oil in your pores, lifting plugs to the surface. The second, active cleanse can then penetrate deeper, clearing out the pore without stripping your skin's protective moisture barrier. This prevents the rebound oil production and irritation that often makes congestion worse. Blackheads, 2-3x weak BHA, salicylic, inside pore decongestion. Whiteheads, sensitive zones, PHA, LHA, or lactic, surface smoothing with low irritation. Press, don't rub. Overexfoliation, chach micro tears, more clogging. T-zone only, kaolin, bentonite, volcanic clay, 8 to 10 miniurins. Optional mix-in, green tea or aloe for calmer finish. Rinse before fully dry, 80% dry, imperfect, to avoid dehydrating the barrier. Now that your skin is prepped and softened from steam or a clay mask, we can move on to the extraction itself. But first, the most critical step, sanitation. We are about to create a small opening in the skin, and introducing bacteria can lead to inflammation, infection, and potential scarring. Thoroughly sanitize your comedone extractor with a 70% isopropyl alcohol swab. If you're using your fingers, which we recommend only for the most superficial blackheads, ensure they are clean and wrap them securely in a single layer of tissue. This not only prevents bacteria transfer, but also provides a gentle, non-slip grip, protecting your skin from your fingernails. For blackheads, position the loop of the extractor the blockage, not directly on top of it. Applying pressure on the plug can force the contents deeper into the pore, worsening the impaction. Instead, press gently beside the plug and use a slow, steady, rocking motion. This technique coaxes the contents up and out of the pore from the base. The goal is a clean, complete lift with minimal force. This is your most important rule. If the plug doesn't lift with light, gentle pressure after 1 or 2 attempts. Stop. Forcing it will only traumatize the surrounding tissue, leading to inflammation, post-inflammatory hyperpigmentation, and even permanent scarring. A stubborn impaction is not ready to be extracted and is best left for a professional. Whiteheads are different. They're closed comedones. A trained professional might create a tiny opening with a sterile lancet, but this should never be attempted at home. Your best and safest tool is a hydrocolloid patch. These patches create a moist, protected environment, drawing the fluid and pus out of the blemish overnight without breaking the skin. Simply apply it to clean, dry skin, and let it work its magic. Immediately after a successful extraction, it's time for post-care. Gently swipe the specific area with a localized salicylic acid toner on a cotton swab. Salicylic acid is a beta-hydroxy acid that can penetrate into the pore, helping to clear out any remaining debris and reduce inflammation. This final step helps ensure the pore stays clean, minimizing the chance of it refilling or becoming irritated. After cleansing, your skin's barrier can be a little vulnerable. This is the perfect moment to calm and soothe any existing redness or irritation. Reach for a gentle, hydrating toner or essence. Look for hero ingredients like heartleaf, which is naturally anti-inflammatory, or Centella asiatica, also known as Cica, which is fantastic for repairing the skin barrier. Panthenol, or provitamin B5, is another excellent choice for its ability to deeply hydrate and reduce visible redness. Gently pat the product into your skin to maximize absorption. Now for a targeted serum. If you're dealing with oily or congested skin, a niacinamide serum is your best friend. A concentration between 4 to 5% is the sweet spot for effectively balancing oil production and refining the appearance of pores without causing irritation. It also helps strengthen your skin barrier over time. Apply a few drops to your T-zone or all over, gently pressing it in. For active inflamed bumps, a spot treatment can work wonders. Ingredients like azelaic acid or sulfur are great for reducing inflammation and fighting bacteria. Apply a very thin layer directly onto the spot. Don't rub it in, just let it sit on top to do its job. Next, moisturize. Even oily skin needs hydration. Opt for a lightweight gel cream formula with ingredients like hyaluronic acid for a burst of hydration and ceramides to lock it all in. Properly hydrating your skin helps prevent it from overproducing oil to compensate for dryness, a phenomenon known as rebound oiliness. Finally, the most crucial step for your daytime routine, sunscreen. Always finish with a broad-spectrum SPF of 30 or higher. Look for a non-comedogenic formula that won't clog your pores. This step is non-negotiable, as UV exposure can darken post-acne marks and worsen inflammation, undoing all your hard work. Pillowcase 2-3 Kex week, phone screen daily. Post-workout cleanse within 15 minutes, micellar or gentle wash. Don't pick between routines, use hydrocolloid patches instead. Keep makeup brushes clean, avoid heavy occlusives on T-zone. 48 hours, flatter whiteheads, calmer redness. 7 to 10 days, fewer new plugs, smoother nose, chin texture. 4 weeks, visibly smaller congestion cycles with consistent BHA plus barrier care. Blackheads and whiteheads aren't a life sentence. They're a routine problem with a routine solution. If this helped, drop a in the comments, like the video, and subscribe for weekly deep clean guides and real results.